Hi, I'm Dr. Miller with Treasure Valley Hearing, and I'd like to tell you a little about some of the effective treatments available for coping with tinnitus, along with some exciting news about ongoing research that might finally result in a cure for tinnitus. 80% of tinnitus sufferers are actually able to cope with the noise that they hear without letting it interfere with their routine activities. The other 20%, however, are so bothered by the tinnitus that they find it hard to sleep, read, concentrate, or keep up with their duties at home and at work. Research has found that the difference between these two groups has nothing to do with the perceived loudness of the tinnitus, but has everything to do with how different parts of the brain react to it. So until a cure finally comes along, we have found it most beneficial to provide therapeutic approaches that help the patient retrain their brain. This can help them better cope with the tinnitus and to get them to the point where they are no more bothered by it than they are by any environmental sound. One of the simplest, and for those who suffer from hearing loss and tinnitus, most effective approach is the use of acoustic therapy with amplification, or hearing instruments. The hearing instruments provide enriched environmental sounds, which reduces the level of the perceived tinnitus. Some hearing instruments also include a sound generator that can produce a soothing noise that can reduce the irritation level of the tinnitus. Another common therapeutic approach is known as tinnitus retraining therapy, or TRT. TRT uses a direct counseling method aimed at ending the negative reaction to the tinnitus, along with acoustic therapy. Successful adaptations of TRT include tinnitus habituation therapy, neuromonics, and my personal preference, progressive tinnitus management. All of these treatment programs can reduce the severity of chronic and bothersome tinnitus, but they are time-consuming. Be prepared to spend 2 to 3 hours for the initial evaluation and about that long for monthly follow-up sessions. Now, I promise some exciting news about some current research that might lead to a cure for tinnitus. A team of researchers from the University of Texas at Dallas has been able to treat tinnitus successfully in mammals by using a tonal stimulus paired with brief pulses of vagus nerve stimulation. Sounds kind of complicated, but the effects appear to be long-lasting. Human trials are currently underway in Europe, and if the technique is found to be successful in humans, the treatment might be available in the United States within a few years. Until then, follow the advice of your hearing healthcare professional and find the approach that works best for you. And follow the advice of the American Tinnitus Association. Number 1, do not panic. Your tinnitus is usually not a sign of a serious medical condition. Number 2, check things out. See your audiologist or an ear, nose, and throat specialist. 3, review your current medications with a medical professional to rule them out as a contributing cause of your tinnitus. 4, be a detective. Keep track of what may be triggering your tinnitus. 5, be wary of anyone that gives you a hopeless diagnosis or advice that nothing can be done, so just go home and learn to live with it. 6, be willing to do whatever it takes to find the right professional who can provide the help you need. And please feel free to call us here at Treasure Valley Hearing should you desire an appointment for further information.